Hello and welcome. Today we're talking about leukemia, a type of blood cancer.
In leukemia, blood-forming cells in the bone marrow make many cancerous white blood cells that don't work properly. This weakens your immune system.
Epidemiology. According to the latest WHO data published in 2020, leukemia deaths in Philippines reached 3,596 or 0.53% of total deaths. The age-adjusted death rate is 3.83 per 100,000 of population, ranks Philippines number 80 in the world.
Leukemia can be classified on the basis of speed of progression and the type of cells involved. On the basis of speed of progression, leukemia can be further classified as acute leukemia and chronic leukemia. In acute leukemia, the abnormal blood cells are immature blood cells. They can't carry out their normal functions, and they multiply rapidly, so the disease worsens quickly. Acute leukemia requires aggressive, timely treatment. Chronic leukemia involves more mature blood cells. These blood cells replicate or accumulate more slowly and can function normally for a period of time. Some forms of chronic leukemia initially produce no early symptoms and can go unnoticed or undiagnosed for years. Lymphocytic leukemia and myelogenous leukemia. Lymphocytic leukemia affects the lymphocytes, which form lymphatic tissue. Lymphatic tissue makes up your immune system. Myelogenous leukemia affects the myeloid cells. Myeloid cells give rise to red blood cells, white blood cells, and platelet-producing cells. The four main types of leukemia are acute lymphocytic leukemia, acute myelogenous leukemia, chronic lymphocytic leukemia, chronic myelogenous leukemia. Acute myelogenous leukemia occurs in both children and adults. Acute lymphocytic leukemia is most common leukemia in children, but it can also affect adults. Chronic myelogenous leukemia mostly affects adults. Chronic lymphocytic leukemia occurs mostly in people over 55 years of age. Other types include hairy cell leukemia, myelodysplastic syndrome, and myeloproliferative disorders. Scientists don't understand the exact cause of leukemia. In general, leukemia is thought to occur when some blood cells acquire changes in their genetic material or DNA. A cell's DNA contains the instructions that tell a cell what to do. Normally, the DNA tells the cell to grow at a set rate and to die at a set time. In leukemia, the mutations tell the blood cells to continue growing and dividing. When this happens, blood cell production becomes out of control. Over time, these abnormal cells can crowd out healthy blood cells in the bone marrow, leading to fewer healthy white blood cells, red blood cells, and platelets, causing the signs and symptoms of leukemia. Leukemia symptoms vary depending on the type of leukemia. Common leukemia signs and symptoms include fever or chills, persistent fatigue or weakness, frequent and severe infections, losing weight without trying, swollen lymph nodes, enlarged liver or spleen, easy bleeding or bruising, recurrent nosebleeds, tiny red spots in your skin, excessive sweating, especially at night, bone pain or tenderness. Factors that may increase your risk of developing some types of leukemia include previous cancer treatment, genetic disorders, exposure to certain chemicals such as benzene, smoking, family history of leukemia. To diagnose leukemia, your doctor may perform physical exam, blood test, or bone marrow test. In physical exam, your doctor will look for physical symptoms of leukemia, such as pale skin from anemia, swelling of your lymph node, and enlarged liver. By looking at sample of blood, doctor can determine if you have abnormal levels of red or white blood cells, which may suggest leukemia. A blood test may also show the presence of leukemia cell. Sometimes leukemia cell stays in bone marrow and don't circulate in blood. Your doctor may recommend a procedure to remove a sample of bone marrow from your hip bone. The bone marrow is removed using a long, thin needle. The sample is sent to a laboratory to look for leukemia cells. Specialized tests of your leukemia cells may reveal certain characteristics that are used to determine your treatment options.
Leukemia is a cancer that originates from blood cells while they are forming, usually white blood cells. Options may include one or more of the following: chemotherapy, radiation therapy, targeted therapy, immunotherapy, and stem cell transplant. Chemotherapy uses drugs that travel through the bloodstream to kill fast-growing cells like cancer cells. Another treatment option is radiation therapy. It uses radiation to kill cancer cells or stop them from growing. The target area of the radiation varies depending on the stage and type of leukemia. The type of radiation therapy used for leukemia is external radiation. It uses a machine that aims radiation at the cancer from outside the body. Targeted therapy uses drugs that aim for specific targets or markers on cancer cells. Since cancer cells may have more of these markers than normal cells do, targeted therapy may affect cancer cells more than normal cells. When targeted therapy drugs attach to the markers on cancer cells, the cancer cells may stop growing and dividing. Immunotherapy can help your immune system fight leukemia. For example, monoclonal antibodies are laboratory-produced versions of proteins that your immune system makes to fight bacteria, viruses, chemicals, and other foreign substances. Monoclonal antibodies can be designed to attach to markers on leukemia cells and become part of the immune system attacking the leukemia. When attached to immune cells, monoclonal antibodies can help recognize and destroy the leukemia cells. A stem cell transplant replaces blood-forming cells that were damaged or destroyed during your cancer treatment with either your or a healthy donor's stem cells. First, healthy stem cells are collected from you or a donor. Then, the stem cells are stored while you receive treatment for cancer, such as chemotherapy or radiation, to kill all your blood cells. After these treatments are complete, the healthy stem cells are given to you. In your body, these stem cells provide a healthy supply of future blood cells.
Management, social support. Living with leukemia can be challenging. Supportive care is crucial, addressing pain management, nutrition, and emotional well-being. Psychological support for patients and their families is essential throughout the journey. Rehabilitation. Rehabilitation and physical therapy can help manage side effects and improve quality of life. Palliative care focuses on comfort and quality of life, especially in advanced stages of the disease.
Cancer prevention.
Here are some key strategies for reducing your risk of leukemia. Quit smoking. Smoking significantly increases the risk of multiple types of cancer, including leukemia. Quitting smoking is one of the most effective ways to lower your risk of this disease. Maintain a healthy weight. Obesity is another controllable risk factor for leukemia. Maintaining a moderate weight through a balanced diet and regular physical activity can help reduce your risk. Avoid exposure to certain chemicals. Benzene and formaldehyde are known to increase the risk of leukemia. If possible, avoid exposure to these chemicals, which can be found in some workplaces and buildings. Limit alcohol consumption. While the exact link between alcohol and leukemia is not fully understood, limiting alcohol intake is generally recommended for overall health and cancer prevention. Eat a healthy diet. A diet rich in fruits, vegetables, and whole grains can help support overall health and potentially reduce cancer risk. Get vaccinated. Vaccination against hepatitis B can help prevent liver cancer, which can sometimes be linked to leukemia. Minimize radiation exposure. Exposure to high levels of radiation, such as from medical imaging or nuclear accidents, can increase the risk of leukemia. Limit unnecessary radiation exposure and follow safety protocols when working with radioactive materials.
Leukemia is a serious disease, but it's not a death sentence. Early detection, effective treatments, and ongoing research are giving patients more hope than ever before. If you or someone you know is affected by leukemia, remember that you're not alone. There are resources and support available.